So WaterAid celebrates World Water Day annually to raise awareness about the effect of inadequate access to water in the world. The day is marked with messages and appeals to duty bearers and stakeholders to prioritize water services for everyone, everywhere. This year's World Water Day is collaborating with a multimedia group to carry out a series of media advocacy activities to mark the 2020 World Water Day. The theme is water and climate change. And we have a conversation in the studio with Mr. Jesse Kofi Danko, who's head sustainable programs at WaterAid. Also in the studio is Mr. George Kobinayok, who's head policy advocacy and campaign, also with WaterAidGhana. Good morning to you, gentlemen.
Good morning.
In the wake of the coronavirus, we've heard a lot about water, particularly people complaining that they say we should wash our hands and are running water, yet some people don't have water. So water is crucial and essential. Yeah. Let's build on that a bit. What can you use any other thing apart from water in washing your hands, for instance?
Thank you, Mama V. Well, in our programs, we've been confronted severally with these challenges. Sometimes for hand washing we advise the use of ash because in some communities it's difficult to get access to water.
No water at all?
Yes.
Wow. How is that possible? That a community can have no water at all, not even water in the ground?
Okay, they may at a particular period have water, but like we are talking because of climate change. And in Ghana, when we want to define climate change, largely we say it is concerned about drought, prolonged drought, and flooding. So if you're not having flooding and you're having prolonged drought, you agree with me that even the dugout can dry out, and people have to travel miles and miles to get water. That water they get, maybe they'll prioritize drinking over anything else. So to be advocating again for them to use that small water to wash their hands,
that will be a problem. That
will be a problem for them. But we advise that in the event that you don't have water for hand washing, at least after visiting the toilet, you can use ash.
We'll come back to the ash, I'm curious. Okay. But how many of such communities do we have? How many places like that have you visited? The places where there's no water at all?
Yeah, as Jesse rightly said, WaterAid is really working in very remote and deprived communities. We have communities with water, but we are looking at safe water, or water that will not give you disease or sickness. In communities, they may have water, but that water will be shared with animals. It can be a handheld, it can be a pond that was built maybe for farming, but because they don't have any alternative, that's what they are really using. So you realize that the water that they are supposed to really support them to be healthy is rather giving them sickness and diseases. So that is a situation. So you by all means get some sort of water, but whether that water is water that human beings should use is another issue for discussion. So you have some sort of water, but whether that water is a water that human beings should drink, it's another issue that we need to really
we've done stories here where we see a very dirty stream. Sometimes it's difficult to even describe it, a combination of many things. And you find people drinking it, washing, animals also using it. I mean, and you ask yourself, is it still in Ghana? Like, are we still in Ghana? But there are apparently many places like that.
Oh, yes.
Yeah, a lot.
You know, for WaterAid, we work in vulnerable and most deprived areas. So we see a lot. Yeah, we are not interested in the affluent communities, people who are really in dire need, the marginalized, the deprived, the hard to reach areas. So we are confronted with this kind of situation.
Interesting. So, and we some of us sit here and we're crying for, because the water is not running through the taps. The people who don't even see taps, they're just looking for potable drinking water. Really doesn't matter the source. But we're focusing on two communities, aren't we, in this conversation? Tell us about these communities. George?
Yeah, we are looking at area that we are working, not really two communities.
Okay.
We are looking at, we are now in one municipality, and we are also in Bongo and Kasana West, in the upper east region. And in all, in those areas, we are working with about 38 communities.
38?
8 communities in these areas to really support them to have.
What do they have in terms of water?
Some of them have hand-dug wells. They have some pond. They have some also have some limited mechanized water systems in those areas. But a situation where the connection is really linked to the electricity. Most of them is also not able to even pay the electricity, the bills of the electricity bill, which is also affecting the flow of water. So WaterAid, through our assessment, realized that there's a need for us to come out with a technology that is appropriate and that is user-friendly, that is also good for that particular environment, so that at least they can have continuous water for a long period. Even though if they're going to maintain it, it will take a longer period for them to contribute towards that maintenance. So we are really looking at those deprived communities in Bongo, Kasanankana, and Wa Municipal Assembly. Okay.
So what's the plan?
Before I respond to that, I'll just add something quickly to what just said. Our approach is normally to do what we call a baseline study. So in those areas, we'll first assess what is on the ground, like you rightly asked. Then together with the municipal and the district assemblies, we agree on the communities that we have to intervene in, depending on the need on the ground.
You're not intervening in all 38?
No. But in the upper 8, we've intervened in 43 communities.
Okay. All put together?
All put together. And in Wa, we are currently in 25 communities.
Okay.
With various interventions. We have hygiene campaign, we have some areas we have water supply to schools, to communities. In some other areas, we have incinerators for the healthcare facilities and water after the healthcare, because we are redefining what a healthcare facility should look like. If we say you have a government says that it's putting up a healthcare facility, what are the things that we want to see to call that in that it has a full complement of water and sanitation? So based on our baseline studies, the initial work we do, because the purpose is to track the change. Are we really making any impact with our intervention? So you need to know the before situation, then after we had intervened, we go with another documentary. Some of them, of course, you've been supporting us to see what changes we have made across the period. Okay.
So out of this 38, how many of the communities are we doing something for? Or we would touch all 38 but in bits?
Yes. In our approach, we are looking at more comprehensive sort of approach. When we look at the Bongo, Kasana, and Kana facility we are supporting, even though the focus of the project was really looking at wash in healthcare facilities, but we also ensure that the schools in that environment will have access to water, sanitation, and hygiene facility. We supported communities to build their own latrines to ensure that they also end open defecation in that environment. So we are looking at total development in that particular area. So when we really go into a particular area, we try to ensure that all those needs are addressed. And as JC rightly said, with the assessment, we really know that it came out clearly that in terms of even water for healthcare facilities in Bongo, they were less than 60% of the healthcare facility with access to water. And also they were less than 10% with access to sanitation.
So these are what, like clinics, CHIP compounds?
Yeah, the CHIP compound clinic, health centers in that particular environment. And you can just imagine a health facility without water, without toilet. Sorry. So those were the critical issues. And because of that, people go to the facility to assess health, but they will come out with other sicknesses and other diseases. So with all this, with the engagement with partners, communities, and local NGOs, we try to really design the program in such a way that the communities, the healthcare facilities, and schools will have access to improved wash. So when you go there now, it's a model that government is interested. Development partners are interested.
As in your model?
Yeah. That interested, and they are really ensuring that the government is even coming out with a guideline to ensure that at the end of the day, every healthcare facility that is built they will consider the component of water sanitation hygiene as very, very relevant component of the whole facility.
Great. So Jesse, what does the people, the community itself, what role do they play?
Well, our approach is that they must make their own informed choice. So when we go with the intervention, we mobilize them and discuss with them. There are instances that we move to communities that they rejected us. Probably they didn't understand.
They rejected water and sanitation.
Yes.
Please help me understand that.
They did. For the fear that they don't want to pay for water. Even after we had assured them that we are using solar integrated system, we are not using the national grid. So in terms of operation and maintenance costs, is going to be less. They are just going to pay something small. We encourage them to pay.
Is it an issue of mistrust or simply fear?
It's difficult for me to say exactly what informed that this decision. But it will interest you that they are coming back now, knocking at our door again. And we are saying that it is too late because we moved to
Other communities.
Other communities who were willing to. So in all, we also want them to understand their rights, their wash rights, that they have rights, that if any government is doing something for it, it's not that the government feel like it is your right.
It's not a favor.
It is
you
not a
deserve
favor,
it.
That is the word. It is not a favor. So we also take them through what we call the human-based rights approach for them to understand their rights so that they can engage the duty bearers. In their case, it's the municipal and district assemblies. So we have advocacy groups in the communities, and they are championing the demands at the assemblies. So they move to them, they engage them, they dialogue with them, just to know that this is our rights and this is what we are demanding. Of course, they also understand their responsibilities. So in this case, for instance, if we talk of sanitation, we have an approach that we call the community-led total sanitation, which is do it yourself, and that one, the responsibility is on the communities to construct their own household latrines. With only technical advice from them, we don't provide any finances, we don't provide any resources. Of course, we will train the latrine artisans, people who guide them in constructing the toilet. But for the resources, we want them to mobilize local materials. And that is where probably we would like to link it to climate change, to assess whether what we are doing is enough or we need some other alternative to be able to respond to the climate change.
Please explain the picture that we're seeing on the screens now.
Okay, so this is a household latrine. Ideally, it should have a vent pipe. Okay. And the door should be closed with just a space at the top covered with net to admit sunlight. It admits sunlight into the room, and it's expected that the wind that is coming from outside, so normally you construct in a way that it faces the wind direction. The wind should be able to, or the air should be able to enter the pit and take the odor through the vent pipe to the environment. Okay. No fly is allowed in because we cannot prevent flies from coming to our homes, but we don't want any fly to carry feces. So unknown to us, for several years we have been eating others people's feces.
Oh no!
Oh yes. So that is why it should be a concern of everybody, not because you are living in a beautiful house. The beer you are taking and the fly has dropped, you don't know where the fly is coming from and what the fly is carrying. So we want it to be the concern of everybody. And whatever means we will support, we can support. So the next one is an institutional latrine for schools. Like George said, we are talking of total sanitation. So you cannot have improved system in the healthcare facility without having it at home.
So this is an approved one. This is because everything that you describe in terms of the doors closed, the vents.
Yeah, the vents pipe.
Okay. This is a KVIP, so this is a standard one.
Okay. Yes. Is this under your guidelines in terms of the people overseeing and training?
Yes, you know we operate in a sector, in the wash sector. So this is an acceptable technology.
Okay. All right. Well, what other? Okay, there's another one that I'm seeing, but it's not on the screen. This one.
Yes. This is what we call TP tap. So in areas we are saying that people should wash their hands under running water, and this is running water. This is locally constructed. There is a stick that you step on it. It's able to tilt the gallon for water to come out.
So you're not touching.
You are not touching.
Okay.
Which I would even say is even better than than the
one
sink.
that we use.
Yeah, the one that we, because that one you touch it. This one is only your leg, and it's able to tilt for you to watch.
Okay, so this, you know, you're showing us some of the things that you do in these very deprived communities. My other question is, you know, a lot of these areas are scattered. You actually don't have the homes together.
Yes.
So are you identifying a common spot where each person in the community can come and have access?
Yeah, they have a fetching, like this particular mechanized system. They have a fetching point where they come and fetch the water. Even in their normal situation where they have the boreholes and hand dug wells, they still have a common place that they all go to, because it's where it's located and where they can even get the underground water. So there's a fetching point. But because we are also helping them to improve on the health systems, the infant and child and mortality, we ensure that there's also the system that is such a way that is piped into the clinic or the healthcare facility. So in the maternity, there is a sink, there's a toilet, and all those things. And we ensure that the design is such that we have toilet for the outpatient, we have toilet for inpatient, and we also have toilet for within the maternity block, so that the women who are coming to deliver will have access to water, sanitation, hygiene within that premises. And we design such a way that it's also disability friendly, and also it's also address the needs of gender, because the need of women are different from the need of men insofar as water and sanitation issues are concerned. So we design such a way that we consider issue of gender in our design, factor in issue of disability, who will come with their wheelchairs, who have access. So all these are factors in the design that we have.
Okay, that's quite comprehensive.
Yeah, very comprehensive.
I'll come back and talk about maintenance. Yeah. Maintenance and the ash.
Yeah.
But let's get to our correspondent, Albert Sori, who's toured some of the areas that you've mentioned. Albert is joining us via Skype. Albert, good morning.
Good morning.
Maybe we should talk about the power situation in your area, because that's the reason we don't have a comprehensive package from you. But explain some of the places that you have been to with regards the water, sanitation, hygiene issues.
Okay, so in the upper, the places I have visited in the Katsina Coast, as well as the Congo district. Now, there are several communities in the area where water needs somewhere. And
Albert, we're getting some feedback, and I'm not sure if you can put the output off so that we can hear only what you're saying. Otherwise, we're getting some feedback. So let's get Albert to work on that. And then Albert, sorry, is our correspondent who's toured some of the areas where WaterAid is making some interventions. He's joining us via Skype to paint a picture for us. We've been talking about, explain what we are seeing, because there's a picture that there's a picture on the screen.
I'll take that. So what we are seeing there is an elevated tank with poly tank, and in the which is not showing clearly, you have seen the solar panels, which is the energy source we are using to pump the water into the overhead tank. You see the fetching point that we have 6 fetching points. 3 are made like the shower type, like George set up to address the disability issues. When we say disability, it's not only people with physical disability, even the elderly has challenge. So, or you go there, you need somebody to help you lift the basin or whatever thing to your head. So that the shower is supposed to address that you just stand under it and fetch your water.
Okay, so I see the 3
shower type. Then there are lower ones that for children if they want to fetch.
Okay.
But one important thing about this is that we ensure water quality. So after we have tested the water, sometimes three times to be sure that the quality is it meets the WHO and the Ghana Standard Authority standards before we develop that well into a product.
Okay, we'll come back and have some more conversations here. But Albert has joined us. Albert, please go ahead.
Yeah, so I was saying that in the Upper East region, looks like they still on, but one of the places that I've visited in the Upper East region is the Bongo district. I've also visited the Katsina West district as well. Now, if you go to Akania in the Katsina West, and then Akong also in the Katsina West, what the people are doing is that they are building their own household latrines. The same in Asatutu, Abednabisi, and some other communities in the Congo district as well. At the time that I've having WaterAid, they've trained these people, latrine in the various communities, but also training other people to construct, help the members of the communities to construct the household latrines. And so most of these communities have been declared open education free. The challenge is that last year, because of the impact of climate change and the floods that came here in the Upper East region, a lot of people also lost their latrines because they collapsed because of the floods. So in the last few days, we've been to the communities again to speak to the people who contracted these latrines that collapsed. 104 of them out of about 400 built had collapsed because of the floods last year. And so our story, planning to tell this morning, was to talk about the impact of climate change on water, sanitation, and hygiene in these areas. And so some people have managed to construct their latrines. Others are still trying to get the resources to reconstruct the latrines all over again, because though WaterAid gave these people the training, them saw the need to construct the latrines because of the benefits that come with not locating in the open. And so they used their own private resources to build the latrines, which some of which have now collapsed. And because of that, they are going to have to reconstruct them all over again.
Sorry, thank you very much. We would see the full package that you put together, but for now we'll leave it here. Let's build on some of the things that he said. And it's unfortunate because with the guidance, some people actually put up the facilities, and with the flats, they've lost everything. Yes. Let's link that up with the management of those facilities. So are you going back to make another intervention? Are you helping them?
Well, like I said from the beginning, this is do-it-yourself approach. No supports in terms of finance from government. But of course, we need to be concerned because when things like this happen, in Ghana's the National Climate Adaptation Strategy, we are talking of preserving and conserving the water resources in terms of quantity and quality. So let's ask ourselves whether this collapsed toilet could have any impact on the groundwater that may serve as a resource for some other communities. So because of this, government needs to be concerned, and we all need to be concerned. So it is important that we come up with alternatives to support them to build resilient toilets.
What would they need?
They would need to line the pit. Yeah. Because what we are doing now is the Aprotech, that people just dig pits, deck it with mud or sticks and other things, local material. But because the water table will rise during the rainy season. In fact, last year what happened was it was torrential rain, which lasted for a very long time.
Comes back to the whole climate change.
Exactly. So once that happens, they are not able to sustain. And one other thing is that people also don't place premium on the toilet. They think it's just a basic thing. Unlike their building that they use mud, the buildings are standing, they have not collapsed. Why should the toilet collapse? So in terms of capacity development, in terms of awareness creation, that it is as equally as important as your household, as your house that you have built, we need to do the best. All in all, they will need to line the pit.
Okay. Because that will cost. That would
cost. That will cement. And in some
but how about the assembly? Because all these places have local assemblies too.
Yeah.
Yes.
And this will be way cheaper than many other projects that we've done similar. Is it easy to get the assembly to support? That's the question I'm asking. Or how easy is it?
The whole CLTS approach is such that the people should use their own local resources to construct a latrine. So that is the approach, or that is the strategy. But looking at the situation in some of these deprived areas, they use their local materials, the thing will collapse. So they keep on constructing every year. And because they have been sensitized to develop the taste for latrine, they already want to also avoid open defecation. They try as much as possible to rebuild. But how long would they continue to rebuild every year? If you are not careful, they will lose that interest. So the assembly and other partners will have to really look at how can we support a very marginalized, those who can really not afford. Those who can afford, let's encourage them to really buy the materials, to really build a more resilient latrine.
So I guess that's the next level of the advocacy that you're doing.
Yeah. So now the community has been sensitized to develop the taste for the latrine. But how long would they construct latrine that will collapse? That is another level of things that we are going to look at. We are looking at now. So we are bringing government on board. We are bringing this assembly and other partners on board to really, with the community, to look at how can we support this community, to how can they commit part of their resources to ensure that they support this community to come out with very resilient latrines.
Yeah. Okay. But with the maintenance plan.
Quickly, the one we are calling the CLTS we are just using it loosely. The whole thing is rural sanitation delivery, and there are 4 components under that. One of them is a demand creation, which we are using the CLTS. You have one component that talks about governance, which boards on government leading and steering sanitation delivery in the grid. So we are expecting that we'll come out with kind of revolving fund, the financing side, to support people to access credit on very low interest so that they themselves can build these resilient toilets.
Okay.
Moving on to maintenance.
Yes, sir.
Of all the facilities. We actually trained for water. We will not leave a community until we have trained a management team.
Okay.
And we have realized
from within the community.
Within the community. Of course, they are not experts, but we expect them to know about preventive maintenance and other things. So what we have added now is that in the past we realized that training them alone and leaving them on their own wasn't enough. We have added a coach now that beyond the project phase will provide somebody who will handhold them and take them through the processes. We ask them to open bank accounts, 3 bank accounts, because we don't want them to sit down when there is a breakdown. Now that they'll go around looking for money, they must always have finances in that, because of course they are selling the water. So, and the assembly engineers were all involved during the construction. So we expect that they will continue to provide the post-implementation follow-up to strengthen them. And we do visit them from time to time. We also have systems that and
how much is the water being sold for?
It depends on the community.
Or if you use a toilet facility, for instance.
For the toilet, they are households, so they don't pay, and we don't build public latrines.
Okay.
So for them, you are not paying. It's your own.
Okay. So in the absence, in terms of after the distractions, do we know how? What kind of toilet facilities they are using, for instance, or they are having to openly defecate because some of the communities, the toilets that they built have simply been washed away?
Yeah, most of the communities have reconstructed their latrines. Last year, 19 of them were declared open defecation-free communities.
Okay.
But we need to go back after maybe the current rains. We have to go back and see whether they still have the latrines standing, and they are still using them. So that is important. But as I said, because of the awareness creation that really started the whole project, they have developed that taste for it. So even though in collapse, they try as much as possible to rebuild and get that.
Yeah, but the question, I guess the question you ask is, but how many times can they continue to do?
Yeah. So that is it. And those that had collapsed latrine, they were taken through a process to rebuild a bit resilient latrine, and we hope that those things will stand. Those latrines will stand the test of time.
Great.
When we had the current
Okay,
rains.
we have to wrap up, but I can use my last 30 seconds so you can talk to me about the ash, because I said in the absence of kwata water in this era.
Okay. That is in a dire situation where there is no water. Ash has what we call potash. That's the base component.
So this is the charcoal ash. What ash are
Any
we
ash,
talking
the
about?
one that
They use the
burn,
firewood
they
and
use
other
the
things, yeah.
firewood.
Okay.
They can just collect it. You know, it's also kind of it deals with the odor as well. So sometimes for this pit latrine, we advise them that they put in ash to deal with the odor. So ash is good. But my last word is that whatever we okay.
Is it just the ash with nothing?
Yes, it's just the ash.
Oh, okay.
You just rub it.
Just like that?
It's just to disinfect your hand. When you get access to water later, you can use soap and
water. Okay,
water.
great.
But it's better that we say that immediately you come out from the toilet, you must wash your hand. Either with ash or with soap and water. If you don't have soap and water, use the ash.
Okay.
It's better than leaving it like that and contaminating the things that you touch. But in all that we do, our overarching goal is that the groundwater is not polluted, it's not contaminated, whether in climate change era or not. Our toilets are resilient, they are standing firm. And what we are doing now is just an entry point for the community. We are expecting that once they develop that behavior change of using household toilets, they will build on it. In 2 years, if they know that the toilet is getting full up, in 2 years, they will start constructing a resilient one now.
Okay.
But now to deal with the open defecation issue, we said have a place where you can defecate. Get used to it, develop that behavior, then in future you build a better one.
Okay, great. Well, thank you very much. This will not be the last. We'll have many conversations because of these projects. But thank you for your time this morning. Stay with us. We've got some other conversations coming up your way here on the Edge.
Thank you.
Thank you.